graphics card that were published about the about our participation in our event. She's currently running the fellowship in Kenya. She's a final year PhD student at Swedish University of Agricultural Sciences in Sweden. She holds a bachelor's degree in food science and technology, and she has a master's degree in food safety and quality from the University of Nairobi. So her PhD research currently focuses on food safety and risk assessment in informal markets in East Africa. So she's our research and career interests lie in food safety and foodborne disease surveillance within the One Health context. So to start our introduction to one another, I will ask you to type your name, the country you're joining from, in the chat box, and most importantly, do you think that we could have gotten someone better for this particular session than Dr. Maureen? I would say no. This is the first person we have gotten, but then I want to hear your opinion as well. In the meantime, Dr. Maureen, please welcome to commence your presentation. I believe I've stopped sharing. All right. Thank you.
Thank you, Dr. Dauda. Am I coming through okay now?
Yes, we can hear you loud and clear.
All right. Let me start by sharing my screen. Yeah. I just need to hide this and then we are good.
Yes, we can see your screen now.
Yeah. Good. Thank you so much. I believe maybe I can start by answering your question. I believe there are better people than me. I am not the epitome of goodness in terms of speakers, but I'm delighted this day to be joining you, and I'm happy for the opportunity to be able to present on food safety and youth involvement in food safety education in Africa. Thank you very much. Thank you also for providing a platform where people can engage, can meet, dialogue, and also form meaningful partnerships that can be helpful in the present and also in the future. I'm just trying. I hope this will not be quite a distraction. So let's see.
What is that?
There is a panel that is appearing on my screen, but I think it's fine now.
Okay.
Yeah. Yes. I hope you don't see it on your end.
No, we don't see. We only see in your presentation. Yes.
Great. Okay. In that case, I will just go on. So this is the outline of my presentation. I will start off with an introduction and some definition of terms. And then I'll present the case of food safety in Africa. What is the current status in terms of the burden of foodborne diseases, the trends and implications? And also, then we'll go into innovative approaches in food safety. I present some of the work that we are doing at ILRI in terms of food safety and One Health. And then we can also discuss or present some opportunities for youth involvement and later on conclusion. And so I hope you buckle up and join me in this journey. Thank you. So what is food safety? It's just the assurance that food will not cause harm when it is prepared and consumed according to its intended use. And also we are going to talk a little more about informal markets, because these are the typical markets that we have in East Africa and also in West Africa and many other low and middle income countries. And so typically these are markets where food is accessed, but then they are very heterogeneous, and also they kind of escape formal regulation and control in terms of social protection, policy and regulation, and also labor laws. So these are the typical markets that we have. For example, open air markets, kiosks, small eateries, and such like. I guess many of our audiences coming from the west of Africa, I'm sure you also have this. Then what is One Health? One Health is an approach, and I tend to think of it as an approach, more of an approach than a discipline. And so it is an approach of the way we do things, and recognizing that there is an interconnectedness and also an interdependence amongst the health of humans, animals, and environment. And so our working then is geared towards a oneness in terms of ensuring the health of humans, animals, and the environment. The case of food safety and foodborne diseases in Africa. And when we look at Africa as a continent, the last study that was done in terms of foodborne diseases, the burden of foodborne diseases, was done in 2010, and it was published in 2015. And from that study, we saw that low and middle income countries are quite burdened when it comes to foodborne diseases. So this here is the African region. The first two bars represent the African region. So there is the Africa D and also the Africa E. I know that most of the East African countries are lying on the Africa D. Also, some West African countries are lying on the Africa D subregion. And in the Africa D subregion, the disease burden is at 1,200 DALYs per 100,000 population. And this is quite high. Looking at other regions, other global regions, such as, you can see that Europe is quite low. Of course, Southeast Asia is a bit high, following closely to Africa, and also the Americas are following after that. So then we see that as the African continent, we still have so much to do. Still just giving the statistics in terms of burden of disease. There were, from that study, which was done in 2010, published in 2015, and we are hopeful that there is a new study that is coming up, maybe end of this year or beginning of next year. 31 foodborne diseases caused about 600 million cases and 420,000 deaths. In terms of the African burden, I have already mentioned 1,200 DALYs, but the economic losses are at 20 billion US dollars in terms of productivity, and an additional 3.5 billion US dollars in terms of treatment costs. And it's good to mention that this study gave a caveat that from the African continent, due to lack of data, most of the burden was quite underestimated because of lack of data. And so this economic burden that we see is from this study, but then we see that this is an underestimation. So we have thought that it might be higher than this. And on top of just economic losses, there are other losses like psychosocial. Most of this we are not even able to estimate, because psychosocial losses or losses that we experience as individuals cannot be estimated. I have come across some other studies, like studies done in Burkina Faso, and they established that they lose about 391 million US dollars to foodborne diseases caused by Campylobacter, Salmonella, and E. coli. The same in Ethiopia, but this time the burden is a bit higher at 793 million US dollars. And so you can see that this is quite a huge burden to the economy and also to individuals and households, most of which are depending on maybe this one person for livelihood. And the burden is mostly caused by zoonotic hazards or zoonotic risks. Most of them are Salmonella, E. coli, Taenia solium, Campylobacter. They top the list. So then One Health then becomes very important, because then we are looking at animals that are feeding us, providing food security and nutrition, but at the same time, they pose a risk in terms of the health burden. to individuals and to the economy. The agri-food system and the food safety in the agri-food system, how do we see it? We are seeing that there is an upward trend in terms of population. The population is growing. I looked at the data. Now we have a population of 1.5 billion people in the African continent, and this is estimated to grow to 2.5 billion by 2050. And as the population is growing, there is also need for food. There is the need for food production, and so there is pressure on the system to produce more. And there's also pressure for changing diets and food nutrition and security. And all this is leading to, it is like a ripple effect, climate change. As the pressure increases, there are new food sources that are coming up. We have, there is quite a debate about protein sources that are non-animal protein sources. There is also the debate about antimicrobial resistance because of high use of antimicrobials in our food production systems. There is urbanization as people are trying to fit in. And so technological advancement, AI, we know that is quite a big debate right now. And so all these are not only a burden on individuals, not only a burden on the economy, it's also a burden on our systems. How robust are our systems to be able to withstand the pressure that we are experiencing? So these are the challenges that we are experiencing as a continent, as countries, as different continents. We are experiencing these challenges, but then what are the solutions to these challenges? And so I guess this is what we are going to discuss a little more today. So I put this here to say that what we have is no longer a food chain. It's now a food system. When I was growing up, we could milk our cow and consume the milk. It was almost a food chain, that the milk is just coming from, we know where the milk is coming from. But right now, maybe for many people, that's not the case, because the milk has to go through many actors, many systems before it reaches the final consumer. And so all these are processes, all these are technologies, all these are production of waste, and many other factors that are included here. And so I just put this to say, we now have a food system and not a food chain. And our food system is more global than local. You can find that your meat, I don't know about you, but for example, in Kenya, we import a lot of eggs. Eggs are coming from other countries, surrounding countries. For example, we also import milk, as much as we are a big producer of milk. So yes, our system is more global than local, and that also complicates the number of things in terms of food safety. And then as this continues, we also see that we have new hosts in terms of pathogens versus what we used to know as natural reservoirs of pathogens. And we have also talked about my antimicrobial resistance, and more resistance is coming. More and more, we see more and more resistance to antimicrobials because of this, the pressure that is exerted here. And also being a food system with animal, human, and environmental factors, practices and behaviors are here. We have social-cultural beliefs that we need to think about. We have, in terms of animal, what species, what breed or age, and animal husbandry practices. In terms of the environment, we look at greenhouse gas emissions, water and sanitation, humidity, and all this. I mean, in short, this is what our food system is experiencing at the moment. And so we need approaches that are more robust and be able to handle the pressure that is exerted on the system And one of those approaches is a risk-based approach to handling the risks that we experience in our food system, the risk to food safety and health. And so what this slide is reading, risk-based versus hazard-based approaches. We see that hazard-based approaches may not be prioritizing what is important in certain contexts. For example, I can give an example of there is a dye called Sudan red that is used in it is used in foods, but mostly in it comes from the Asian continent and it is exported so much into the EU and also the US. So Sudan red is because carcinogenic. And so in terms of priority, then the EU and the American country, the EU and the Americas, then need to prioritize Sudan red as a risk in their food systems. Then we come to Africa. Do we have a problem with Sudan red? Maybe not. Maybe not, because we are not big consumers of this, because it's mostly used as a food color. And so a risk-based approach is most appropriate in our context. And why also a risk-based approach? Because it has three facets. It has the risk assessment, the risk management, and the risk communication that we know. And in all these facets, or in all these pillars, we have an interconnection of people of different expertise. And we also bring in political will into it, especially in the place of risk management. We bring in the community when we are communicating what risks are, how to avoid, and strategies to avoid the risk. And so risk-based approaches are the gold standard, say, when it comes to food safety. And how do we then apply, or how do we adapt the risk-based approaches in our African context? Remember, I started by saying that as a continent, one of our sources of food, not one, but the major source of our food are the informal markets. So how then do we adapt our risk-based approaches to the African context? We have to take advantage of our communities. We have to take advantage of the people in our communities. And so one of the approach that we use is called participatory epidemiology, that we may not be able to understand what goes on in the community if the community themselves do not provide the data. We also have the CHV, in this case, represent community health volunteers. We have those in Kenya, and I'm sure you also have them on the West African side, maybe not the same name, but yes, community health volunteers. These are people on the ground that are able to give, it's like a last mile connectivity with the people on the ground. Also the AHP, the animal health practitioners, and how they operate on the ground. And these people are the most important when it comes to disease surveillance. They're able to report what is happening. They're able to provide data, especially just through observation, and also in being in touch with the community. I have talked about risk management. We need to bring in legislature. We need to bring in consumer groups and trade groups. We need youth groups in this pillar of risk management. And of course, risk communication, social media being very important right now, and being used as one of the main sources of communication, especially among the young people. How do we bring in social media in risk communication in food safety and One Health? So, I mean, those are things that we can think about, and those are things that we can leverage on. How do we use social media in science communication? For example, most of us may be using LinkedIn, but LinkedIn, we can say that it is for maybe a more literate demographic, but how are we able to reach the youth that are not as literate and still use social media, for example? So, I mean, those are challenges and also opportunities for the youth that we can leverage on. Another approach that we have been using a lot at ILRI is what we call the three-legged stool approach to food safety, applied especially in informal markets. So I'm sure we have this in Kenya. It's quite a common kitchen furniture, a three-legged stool. And in a three-legged stool, we say that the stool cannot stand unless it has three legs. It cannot stand with two legs. And when we adapt this to food safety, what do we mean? We mean that we need to bring in capacity building. We need to bring in motivation and incentives. We also need to bring in an enabling environment. And what exactly do I mean? In terms of capacity building, we need to provide our actors in the informal markets with training, for them to be able to be aware of what they should do and how to do it. Also provide just simple tools and technologies that they can use and they can use to promote food safety. Provide infrastructure, provide water, provide sanitation, provide sanitation infrastructure, and also provide things like electricity that is important in storage and yes, providing infrastructure that can support food safety in our markets. That is what we are saying as one of the legs of the stool. The second one is motivation and incentives. How are we able to motivate the actors along the chains to adhere to the proper food safety and regulation food safety and regulations, and also the practices? One is we drive them towards behavior change. One model that we have been using is called a nudge model. And in a nudge model, it basically states that a human being is unable to do the right thing unless they're nudged or they're pushed to do it. And so how do we promote behavior change in informal markets? For example, we can provide communication materials, we can provide pamphlets, we can provide posters that can remind the actors from time to time, you need to wash your hands, you need to separate raw from processed or raw from cooked. That is a behavior changed model that we use based on the nudge, behavior change model based on nudge theory. The second one is provide incentives. So what incentives can we provide? Studies have shown that some demographics are willing to pay for a little more, are willing to pay a little more for safer food. So we can use monetary incentives, but on top, in addition to monetary incentives, we can also use social and moral incentives. When we are speaking to actors and telling them that you are contributing to food safety, you're contributing to the health of an infant, you're contributing to the health of a society, and also bringing them in for them to be able to understand. Sorry, someone is talking?
No, we're good. Excellent.
Okay.
We're perfect.
Good. Yeah. So bringing the actors in, how much have we been able to appreciate our smallholders who feed the continent, smallholder farmers who feed the continent? And so for them to be able to know that they are important for us, important to us, important to the economy, those are social and moral incentives that pushes them to do the right thing. And finally, the last leg, and also a very important leg, is the enabling environment. We can provide tools, we can provide technologies and infrastructure. We can also push the actors to do the right thing through behavior change and through incentives. But then if we don't have the support of the public, the government support, and also the public and the private sector, then we have seen that most of the innovations that we present, they fail, and they fail to scale, they fail to become sustainable only because we don't have an enabling environment. And so an enabling environment where we have policies and regulations in place, we have the public and private sectors providing investment through capital, through infrastructure, through the support that is needed. is important to be able to ensure food safety in our markets in the African countries. So those are the two approaches that I wanted to present to us. One was the risk-based approach and how we adapt the risk-based approach in our, to our African context. It has been used, of course, in the West. It has been used a lot, and it is used a lot in terms of regulations, setting regulations. It is used in the Codex Alimentarius Commission. That's what they use in setting standards and regulations. But then we cannot just copy and paste. We cannot just say this has worked in the West, it will work in our context. How do we adapt them? You still use the same principles, but then adapt them in our context. And secondly, the three-legged stool approach for innovations, for them to be able to scale and to be sustainable. The third thing I would like to talk about in terms of food safety and education is benchmarks that ILRI has been producing in collaboration with partners. One is the food safety curriculum benchmarks. So this was produced together with the FAO, and we looked at the region, the East African region, and we found that there were no courses on food safety across the universities in the region. And so together with the FAO, ILRI collaborated, and they have come up with a benchmarks of what it would be for a university if the university wanted to institute or to come up with a course on food safety, a bachelor's course on food safety, then what would they need? And so then this document provides the benchmark for this. And in addition to that, ILRI together with OHiA, they came up with benchmarks for the Master of Science in One Health. So One Health being an approach that is a little new. It has been there, but it has not been operationalized for so long. And so there is these benchmarks that we produced that if a university wants to come up with, an African university wants to come up with a course in Master of Science or Master in One Health, then how do you go about it? And so these things that we can push forward and they can be adopted across different regions. Opportunities, I guess this, when making the slides, this was one of my best slides. I was thinking then, how as a youth, how do we come in? How can we be helpful in our situation? How can we take advantage of the situation? One is, as I started by saying, one of the things that we lack is data in our African context. So how can we be helpful in providing data for policy making, for policy and decision making? Another one is sustainable food production. I talked about how the population is growing. And of course, with the growth of the population, there's the demand for food. But how can we do it sustainably? So looking at the health of the environment, looking at the health of humans, and also the health of animals. How can we produce sustainably? The third one is the risk-based approaches. I have talked about it. And one of these is a HACCP system. A HACCP has also been used, and it is mostly used in formal systems. For example, in food processing industries, they use HACCP systems. But how can you adapt a HACCP system in an informal market? How can you still be able to talk about the lady who sells to you your favorite vegetables or your favorite fruits? How do you adapt the HACCP system to fit such kind of a person? How do you adapt a HACCP system to fit a smallholder farmer who has less than 1 hectare of land, has one cow that is feeding the community. How are you able to adapt the HACCP system to such a context? Then the other one is technologies for post-harvest. I mean, we are losing a lot. The last time I was looking at the data in terms of post-harvest handling, it's quite huge in terms of what we are losing just because we don't have the technologies to be able to preserve our foods, especially fresh foods, fruits and vegetables. How do we leverage on technologies? And they're there are already technologies. There is drying, sun drying, there is freeze drying, there is modified atmospheres. How this is an opportunity for youth to innovate, for youth to scale what is already known. And the last one I thought about, I'm sure there are more, and I welcome more suggestions, is waste management. In our informal markets, one of the problem is management of waste. But using the 3 pillars of waste management, reducing, reusing, and recycling, how can we manage waste in our markets, not only in our markets, but also in our cities across Africa? We can reuse plastics. We can recycle some plastics. We can reduce some of the losses with post-harvest technologies. We can produce organic manure. I mean, there are many things that we can do. And so these are opportunities that young people can think about and can use and leverage to for livelihoods and also for income generation, and as they make the continent better and livable for everyone. And lastly, how do we do it? How do we do this sustainably? Only if we use a One Health approach. Coordination, communication, collaboration, capacity building. If we are able to do what I have presented in the previous slide, but do it in an open manner where there is open communication and transparency, where there is collaboration between teams, where there is proper coordination with leadership and management, where there is continuous improvement. The wordings on my right are just my additions that I thought are some of the key values that we can add into the system to make it more robust and to make it resilient. Systems thinking, teamwork, transparency, and continuous improvement, looking at monitoring and evaluation systems and analyzing what has worked, what has not worked, and what should we do so that it works. So these are my thoughts concerning food safety, education, and youth involvement. Take-home messages. We have a growing demand for food, and with a growing demand, there is increased risk to human health. The burden of foodborne diseases economically and also health-wise is quite huge. But then we need robust and resilient systems. There are many innovative approaches, and youths can seize the moment, occupy the space, and innovate solutions for food security, food safety, nutrition, and health. Thank you very much. This is my last slide. I hope I have not taken all your time.
No, you were right on time. You spent the exact number of minutes dedicated to you, and that was amazing. Thank you very much. And I am happy, I'm proud at the same time because we have set a precedent at One Net in Action initiative of having webinars in which people learn new things. Always when we have our webinars, we bring speakers that always bring on board like new things for our audience to learn. And then I'm very happy that happened today because the 3-stool approach for me was what stood out. And I think we should think in that direction. The food system issues become more complex and complex. When you give example of importation of meat, milk in Kenya, it's the same thing in Nigeria. Milk, meat, and cheese, especially cheese. Almost all the cheese I see on counters, they are brought from Netherlands or the US and so if there is a problem there, of course it can get here. In the EU, there's a problem, it can get here. And me being a veterinarian, when I go to the store and I see these foreign food items, especially meat products, on the counter, the first thing that comes to my mind is, okay, what if it carries a pathogen from there? There is this BSE, mad cow disease, and prions. And we know that prions cause one kind of disease right now, but the fact that we don't understand prions in full means there could be other versions of prions that can actually cause bigger problems, and we don't know. So these are the issues. So thank you very much. An informal market, very important because they are everywhere in Africa. Thank you very much. I really appreciate that presentation. And from the comment section, you can see it's much appreciated. So I want to, on behalf of all the listeners, well, I would not ask that question, but if you're, so it's interaction time. I will take a couple of questions, but before I open the room for question and answer, while you all prepared your questions for our speaker, did you? For myself, I was hearing about the three-stool approach for the first time, three-legged stool approach for the first time. So I would like to ask the audience as well, if you're hearing about this approach for the first time, type yes in the chat box. And if we get 5 responses, then we can begin to take. If you're hearing about it for the first time, type yes. If it's not the first time, you can type no, and then we'd like to hear how you came about it before. But if it's the first time, we want to know. Okay, we have 2 yes, 5 responses. Okay, we have 4 now. Okay, very good, making 5. So question and answer. If you have any question for our speaker, I will prepare to bring in the next speaker. Yeah, okay. So if you have any question, but before the next session, I have an interesting icebreaker session first. But then at least let's have, because if you don't ask questions, we will ask you questions. That is our rule at OHiA. So thank you very much. We're still seeing a lot of yes. Yeah, we really appreciate questions or suggestions or comments. We'd like to take that. Because for me, I have it's not a request per se, but I have some comments about like opportunities for youth, since the dialogue is all about the youth, whether we do it virtually, physically. Yeah, we are all about empowering the youth to do what they do better, and also in some instances, um, uh, we ourselves being youth actually taking initiatives to actually move the One Earth approach forward on the continent of Africa. So I'll have some comments and a little bit of some requests. But before then, we have Papi Ichika. I hope I pronounced it correctly, raising his hand. Please unmute yourself and speak. Matthew, you can type your question in the chat box, or you can unmute yourself and speak. Papi can, okay, yeah. Go ahead, Papi.
Okay. Good evening. Good evening to you all.
Yeah, good evening.
Okay, I had a question to Maureen. When you talked about the three-legged stool approach to food safety, in the branch of capacity building, you talked about training. So my concern is that I, being a researcher, so I was trying to think out loud. Maybe can you please explain more in terms of what kind of trainings do you people do, and are people allowed? I mean, allowed from other countries to come and do the trainings, and how are the eligibility criteria? For example, if you have happen to know some, so that you can share with us. Thank you.
Okay.
Do you want me to answer, or should we wait for the next one?
I only have that one. Only that.
Okay. However, okay, let's have the response to this first, then we go for the next question.
No, right. Yeah. So for the three-legged stool approach, it came out of work that ILRI has been doing for the past about 15 to 20 years of working in informal markets. One is that, first of all, is that you realize that these are markets that did not have or did not get the attention that they should. They provide food and nutrition security to majority of the population in low and middle income countries. They also provide employment to many youths and also to many women. and including men. In addition to that, they also a place of cultural propagation. For example, you go to some markets and some foods are culturally prepared. I'm sure it is happening a lot in West of Africa. So so the training that we are talking about is training of informal market actors. That includes farmers, because those are the main producers or the main suppliers into the market. We're talking about wholesalers, we are talking about retailers, we are talking about actors along the chain, actors along the food chain. And so we provide them with training that is adapted to their context. If they're milk sellers, if they're meat sellers, and also being ILRI, we a lot deal with animal sourced foods. So fish sellers. So we tailor the training to their needs, and this goes on for a number of iterations, or training is done for a number of iterations. And after that, tools are provided that are appropriate to their situation. And also, as we talked about, we bring in the enabling environment in terms of bringing in the local government situations, bringing in the private sector, if there is any private sector or consumer organization, trade organizations that are interested in the innovation, they come in. And lastly, we also provide the behavior, the incentives in terms of behavior change and motivation. So basically, that is the training that I was talking about, and I hope now it is clear. Thank you.
All right. Thank you very much. I believe it is, because that was explicit. Thank you for providing the explanation. We do have some questions in the chat box. Papi, you can, however, go ahead. So before we take these questions, and then we'll go straight to the icebreaker session. It's going to be funny. All right, Papi, can you speak now?
Thank you for the word. Hello, everyone.
Yeah, hello.
Yeah, can you hear me well?
Yes, we can hear you clearly.
Okay, my concern is to know, according to the demographic increasing, people are using antibiotic for the growth of the animal. But how can we do by feeding people securely by not using antibiotics in animals? That's my concern, please. Thank you.
Okay. Excellent concern. Thank you, Papi. Maureen, you want to give a go at that?
Yes, I mean, we are doing a lot of antimicrobial or antimicrobial use studies, and we are seeing that there is quite high, there is misappropriation of antimicrobials. There is misuse, there is abuse of how people are using antimicrobials. And the question, and now I think that is an opportunity for you as a young person. How do you produce food sustainably? How are you able to keep poultry and still be able to do it sustainably without misusing antimicrobials? One of those is using biosecurity measures. Taking care of who gets into your farm and how, when they get in, what do? Do they wash their hands? Do they sanitize their feet as they get in? I mean, biosecurity is one of the measures that has been proven to be as a measure against, I want to say, extravagant use of antimicrobials. Yeah, so biosecurity is one of them, just to answer the question directly, but there are so many other ways. And also, it being a challenge, it is also an opportunity.
Yeah, excellent. Thank you very much for that. You've just said it all, but I would like to just add a few things on. Papi, if the way we can, there are many ways for us to prevent the use of antibiotics, especially in livestock production. Number one is biosecurity, which is encompassive, but it includes, hygiene for the farm animals. Basically, you have to make sure that that the environment where they stay is always hygienic and the animals themselves are clean, which will involve a little bit more work and a little bit more infrastructure. For example, foot deep, such that you can be sure that your animals are not being exposed to pathogens that will induce disease, hence reduce your productivity or increase your cost of production. And then you will not need to use antibiotics. So that is one way. The second way, vaccination is a very big thing we should look into. Most of the times when you're producing livestock at scale, what happens is that the diseases that are endemic in that area, your animals are susceptible to them, and even the vaccine preventable ones. So most people don't even know about the vaccination for this disease. So it is now upon us as youth, whether in groups or as an industry, educate farmers and livestock producers and people in the informal market about like common diseases in the area and the availability of vaccines to prevent these diseases. So that is number two. Thirdly, you see, antibiotics are not magic pills. People want to use antibiotic to cover up for poor housing. They want to use it to cover up for poor hygiene. They also want to use it to cover up for poor feeding. So when most livestock production units, especially in rural areas, they don't feed the animals up to like what they're supposed to feed them, but they want to just give them antibiotics and they start getting fat. So they are using antibiotics for the wrong purpose, which is misuse as growth promoters. No, it won't work like that. So you can also take it upon yourself to educate as many people as possible about this. And when it comes to feeding, let me just give a little bit of hint. Also as part of knowledge that you take up. If you, let's say, for example, want to fatten animals that you obtain for sales, if they are small ruminants, you are to give between 1 to 3% of their body weight every day with sufficient water. And if they are large ruminants like cow, 5% of their body weight in dry matter feed every day. If you do that for 90 days, they are expected to have marked increase in their body weight. So if you do things like this, you won't need antibiotics. So the knowledge is there. We just need to, spread it out and let people know what they're supposed to do. So Maureen, just to assist you there, we have a lot of questions and we have one more presentation and we have the breakout session, which is very good. And based on feedback that we received, we are trying to, before it used to be a 3 hours per day event, but now we are cutting it to 2 hours. So we are almost into the first hour. So I will just answer the question in the chat box. Then we can take the last two and we can go for our icebreaker session. So the first question is, what is the approach for chemical bioproduct disposal use in animal farming in managing drug resistance? So when you have remnants of drugs or all these things and you want to dispose them, you don't throw them. I mean, for every community, as much as I know, maybe local government and so on and so forth, they actually have like the disposal mechanism, especially for biohazardous substances like this. So there are two ways you can go about this. If your community has an active waste disposal mechanism, you go through that channel. If not, then you return it to the pharmacists that sold it to you in the first place, because it is now upon them to dispose it in a professional manner. Whether they are going to incinerate or there is a particular disinfection unit or disarming unit that the process that they will go through before they are being released into the environment, the pharmacist will do it. So those are the two practical ways to dispose by a chemical bioproduct, especially in rural places. Sorry, my distance is failing. I want to check the other questions and answer them pretty quickly. Okay, so okay, we have answered that. Is there a provision, especially in Nigeria, where there's a team? All right, so there's a provision for, we have a senior colleague here, Dr. Sherifat, and if you can add a little bit of context to this, there's actually a provision for meat inspection in particular. So I'm talking from livestock perspective, and it is pretty much the same thing for crop food. through the Federal Ministry of Agric and then the National Animal Quarantine Services. In this case, they have that mechanism, and they also have, especially for food that are going for exports, there's a unit of the customs that check all of these standards. So there are agencies and there are departments that deal with these. What you should know as a veterinary paraprofessional in the animal health, you can support veterinarians on meat inspection. It doesn't have to be like compulsorily you being employed by the state or the local government. It's something you can voluntarily do. It's not a difficult thing. But if you check with the state veterinarian in your department, there is a role for them to play. You support veterinarians when they are going out for meat inspection, and then when they condemn or interacting with the owners of the livestock, you do all these activities and you contribute significantly to food safety like that. So that is one way you can participate. The second indirect way is, when you interact with the farmers that you serve, just tell them, and try to educate them about antimicrobial resistance, to educate them about biosecurity as a way to reduce dependence on antibiotics and hygiene, and educate them about the food system in general, that what you are doing here end up in people's pots, and it's very important. Does ILRI offer volunteering opportunities too? That's the humor.
Oh, no, I've not heard of volunteering opportunities, but mostly they have graduate fellowships and also internships, and they're advertised on the page. Yeah.
Yeah. So yes, you please go to their page. I think we love ILRI so much, and that is why our last three keynote speakers are from ILRI. It's a big organization that we all appreciate. So the next one is people using antiretroviral drugs. And so, Mariamo Asane, to your question, I have also heard rumors about people using these drugs to promote growth in livestock, but I have not seen any for myself. So we are in the same shoes. I've not seen it, but it's a published, information that people use these ARVs to for growth promotion. However, I do not know any mechanism by which antiretroviral drugs will promote growth in livestock. And yeah, maybe something we don't know. And then I don't think it is safe, because eventually you're not subjecting people to low doses of ARVs, and that could cause problems. And we know ARVs, they are mostly drugs that have something to do with the DNA of organisms, whether inhibiting replication and so on and so forth. So whatever the mechanism is something that can have a significant consequence on humans that actually take it. Right. So that will be all for now. Oh, Chukuno, so please, maybe you keep your question for the next speaker. I don't know if he's here, but let's just go ahead to take, if we have time before our next speaker joins, so they take your question, but let's do something. Maureen, as you can see, your presentation took a bulk of time because everybody's interested, right? Thank you very much for the excellent one. We really appreciate, and you enjoy your holiday, and then we will definitely reach back to you in terms of how we can, through ILRI or with the support of ILRI, expand our initiatives when it comes to food safety education. We have done a lot of work. Most of our 1S scenarios presentations are on food security. We have made presentations on Campylobacter, and I'm happy that you mentioned it earlier. And we would like to, collaborate more with ILRI to actually educate people, especially in the West African region, about food safety. And yeah, the informal market, very important for us. We have the capacity to engage volunteers to really conduct physical outreaches to this market. So we will reach out, of course, for further discussions about that. Now,
thank you so much.
Yeah.
Yeah, I might leave because it's late. It's 6 p.m. And yeah, I might leave in the midst of the discussion, but thank you so much for the opportunity to engage with everyone. Yeah, thank you so much. And looking forward to further engagement, further collaboration. Yes, thank you.
Definitely. Thank you so much. Really appreciate, and enjoy your holiday. Happy Independence to Kenya. You can use the reaction to say you appreciate our speaker, or type in the chat box. All right. So before the next presentation, this is a little bit of icebreaker. I call it the One Health plate. Now, if you look at the logo for this year's African Dialogue, you will see that it's a lot of people in OHiA color around a plate of food, right? Is that what you're seeing? That it's on the right of my screen. So you can see people around the plate. So that is the inspiration for this particular icebreaker event. Now, we will not proceed for the event unless we have 5 people, whether to speak or type in the chat box minimum to respond to this. Now, you will mention one ingredient in your last meal, and then you will identify one eating, one else connection related to it. And it can be AMR because it's already on the screen. Of course, it can be AMR, just kidding. But then I would like if it can be something else. I will give 2 examples. Now you can see the example. I took jollof rice and chicken, and the ingredient that has the ingredient that I want to highlight is chicken. And the one connection is that if they have used antibiotics in this chicken, maybe a few days before it was slaughtered and it got to my table, I must have taken low doses of antibiotics, and it might, breed resistant microbes in me, or if the chicken itself has some strains of bacteria that have antibiotics, I must have taken it together. So now in the chat box, or if you want to speak, please you use you can raise your hand. You can raise your hand and we'll allow you to speak. You mentioned the one ingredient of your last meal and the one that's one health connection of that ingredient. Like what could have happened to that ingredient that could have gotten to you, that could have caused problem or something. So I've given my example. Now I'm waiting for your. All right, please go ahead, Ma.
Good afternoon, good evening, everyone.
Good
So
afternoon,
for
Ma.
me, yes, I had fried rice and chicken this afternoon, and you asked that what could be the one health implication of the meal I had. So I would say for the chicken, avian influenza. So I think sometimes we minimize how the impact of avian influenza in Nigeria, especially the low pathogenic avian influenza. It's more like an endemic disease now. There's the high pathogenic that would cause severe symptoms, death, and the rest. So for me, I think it was avian influenza, low pathogenic avian influenza. So if the birds may have come in contact with migratory birds and the rest of that, I could get the low pathogenic avian influenza that may present itself like an influenza disease in humans, and the risk of that is especially during preparation of the birds and things like that. So for me, it was avian influenza, pathogenic avian influenza. Thank you.
Thank you very, very much. Yeah, as you can see, this is very interesting. And yeah. So you see, it's still chicken, but now avian influenza, which means of course there are these risks if we take the step to like identify them. Now we are not saying you should be scared of chicken, but then we're telling you that if you have food on your table, it is not just that food. It is the chain of things that happened to that food before it gets to your table. So thank you very much for that. Very, very nice one. Somebody said, I'm having beans and plantain. Beans, chemical preservative. Excellent. The chemical preservative that can, of course, affect you in many ways is in storage and gets in a system in low doses. And some of them are even poison because they are meant to kill the the pests. Thank you very, very much. Who was that? Okay, Abdul Qadir. That is an excellent one. Also, thank you. So we now have 3 examples, 2 more before we proceed. I mean, if you've had something that contains milk as well, and then I so much love what avocado said, especially that it's coming from plant crop food perspective, so that we are not predominantly talking about animals, even though most of us are vegetarians. All right. So is it a difficult icebreaker? Should I do something less spicy tomorrow? And yeah, so all right. So we will now proceed to the breakout session. It's going to happen for 30 minutes. Then we'll come back to receive our last speaker. He's currently in a situation where he cannot attend right now, but he will soon be out of it. But in the meantime, we'll go for the breakout session so that we don't waste time. We are trying to manage time so that we'll reduce the length of the program. But before we go for that, I would like to make a very short announcement, which is that for certification, we will prioritize participants that attend the 2 days. So please try as much as possible to come tomorrow. It's just 2 hours, no longer 3 hours. And you will get your certificates earlier than those that came for just 1 day. So that said, we'll now proceed to the breakout session. I will give a little bit of context before we go in so that we know what we are discussing. And to make it interesting, okay, yeah, Matthew said I had milk. Exactly. I didn't want to talk about, I was talking milk and tuberculosis and all that. Okay. Antibiotic residues due to poor follow-up withdrawal period. Excellent. And then livestock keepers and lack of awareness. And in milk, there could be tuberculosis, there is that risk as well, brucellosis and all of that. So yes, and all of these are zoonotic diseases. So there is also that risk of zoonotic diseases coming to you. So excellent. Beans and rice or plantains and a chemical-free plantain ripening. Excellent. So, they use chemicals to also ripen plantain. Wow, amazing. Now, very, very nice ones are coming in. So, as you can all see, when you have food on your table, it's not just about like what you're eating right now. It's about everything that happened before you got to your table. So thank you very much. And I think this has opened our eyes to, other aspects of the food that we're eating. Now for the breakout room, the rules are pretty simple. You will engage for between 20 to 30 minutes. And then if you're in room 1, you'll be discussing the causes, effects, and sustainable solutions because as we can all see, the trend so far, everybody's talking about antibiotics naturally. So, maybe we anticipated that. Maybe it's happening on its own. Who knows? If you're in the first room, you have to talk about the causes, why, the effects, like the implications, and then what other alternatives or what solutions do you have to antimicrobial resistance in food production, especially in low and middle income countries, which unfortunately many African countries fall into that category. And secondly, for livestock feeding, we all know that one of the reasons why antibiotics are used excessively and one of the reasons why livestock production is not robust enough for Africa to feed itself, why we have to depend on import of cheese, milk, and livestock products, is simply because, livestock feed is kind of expensive. The current food that livestock are eating, most of those items are also being consumed by human beings. So what are the barriers to exploring, sustainable production and processing of alternative feed for livestock? So we discuss that and come up with solutions as well. And if you're in room 3, genetically mutated organisms and food security. What are your perspectives? What are the implications of GMOs? Can we say they are good? Can we say they are bad? If they are good or bad, how can they help sustainable agriculture? What GMO practices can help sustainable agriculture? So these are the things we'll be discussing in the groups, and I will be sharing everybody right now. So those sharing email, please, if you can stop for now. We will have the networking section, and then you'll be able to share your email, LinkedIn, everything you want to share. You'll be able to share and interact with people. And this is not the end. We are getting closer to ILRI, to One Society in Tanzania, to really, expand the program moving forward. please stop sharing your email. All right, so now we can go into the breakout rooms. So you have seen, I will share the percent. All right, so now the room is open. So you will see a pop-up on your screen at the moment that you have been invited to join such a room. Please join the room, and then whatever you have discussed in the room, tomorrow I will come to the room. I will come to each room and give instructions about what we are going to do with your discussions. Yeah, if you have any if you have any problems joining, please let me know. If you're still with me, you're supposed to be in. If you're not able to join your room, please just let me know. All right, let's join the breakout rooms and see what's happening.
Hello.
Hello.
Hello. Are we doing anything?
Yeah.
I'm sorry, I just joined not too long ago. I saw the whiteboard.
Well, class.
What is internet? What is your name? What's your name? What is your name? How old are you? How old are you?
Hello. Want to know?
What's the matter?
That's okay.
Hello, breakout room members. Hello.
Hello.
I think you are available.
So, are you guys able to join a breakout session?
Apologies. Can you repeat it, please?
Are you able to join a breakout session?
Yes, I'm able to join, but everybody there is silent. No
Oh,
communication.
is that group 3?
Yeah, there are 9 participants, but everybody is silent. There is no communication among
Yeah,
breakout.
so if you can encourage them to speak, please. We want everybody to speak. Yeah, I also observed that, but I just came from there and I already explained what is to be done.
I think it's
So
about the ingredient and the connection. It's about the ingredient, the connection.
sorry?
Is it about the ingredient and the connection?
No, the one about GMOs and food security, yes.
Okay, I don't hear that.
Okay, so should I add you to another group now?
You can. Yes, you can, please.
All right, so let me do that. Thank you so much.
Okay, thank you.
Hello. All right. Okay, great. So thank you so much, everyone, for. I mean, I had some of the conversations. They were brilliant, excellent. So I can't wait for tomorrow, when we'll be taking all the summaries of what has been discussed today. I hope you all had. Yeah, okay. Oh, more. Yeah, this is the problem. So this is this particular live live. I mean, the breakout room at 30 minutes, and before we used to give 10, 15 minutes. So we always try as much to give more and more time, but I don't think time will ever be enough for breakout session. We can modify our one scenarios to be like this kind of thing, and then basically, oh, the time was too short. Sorry. Okay, so we always work on feedbacks, definitely. And what we are going to do is subsequent AYDs or subsequent one scenarios will make room for longer deliberations, and it's going to be basically just participants that are discussing among themselves. Sorry. So, yeah, so the summary will come tomorrow. So whoever has been assigned as the secretary of each group, please go take your time, go and reflect properly and see if and package your presentation. So tomorrow during one of the sessions we are going to take it, and yeah, if there will be no question and answer, so that you not be afraid. Just you come and present that we all give our perspectives, and that's about it. So ideally we have 11 minutes more, and our second speaker for the day says he will be able to join. We have shortened the time of his presentation, and I'm working with him right now to see if he can join and just do a 10 minute talk, and we will not do question and answer. So that we'll keep to time. We try as much as we can to make sure like we keep to time. Like I said, we have reduced 1 hour from the normal lengthy presentation we have on each day. But before then, I think let me just put you through what we have, the lineup for tomorrow, and then whether it comes or not, we can go prepare for tomorrow. 1 second, please. Yeah, excellent. I mean, we always love to do this, and hopefully we will get better. So you should prepare for we have two important webinars coming January. One is scenario part 6, and we also have our midterm webinar for the One Earth Implementation Mentorship Program. So if you have the time, you should try to join us. We'll have engaging sessions as well. Our events so far, I'm very proud. You learn new things, like all of them without exception. Even myself, I'm still learning. Okay, great. Can you all see my screen? I don't know how to make it
positive.
but okay, you can see the screen, but is it small or big enough?
On like portrait.
Oh, okay. Yeah, portrait, but is it all right? So our next speaker is here, but then before he starts, let me just go through. So tomorrow there will be a recap of day one by either Marilyn or myself, just summarizing what we have discussed today. And then there will be a second part of youth involvement in food safety education, especially on the continent of Africa, by Dr. Noel Miranda. And then there will be one cycle. So one cycle is the networking events, and this is where there will be a task that will involve you sharing your LinkedIn, Twitter, Instagram, even if you have TikTok, YouTube channels, whatever you want other participants to help you with, to participate in. If you have an initiative that needs a lot of participation, engagement, this is where and yeah, we understand the media plays an important role in food safety education. And yeah, not just food safety education, the one approach in general, communication is one whole pillar of One Health implementation. So whatever you do in terms of communication, one cycle is where we are going to have one fantastic like activity to bring this up. And then during the one cycle, if you want to link up with someone to participate in the activity or whatever, you can also do that. For us at OHiA, we are going to open our doors for volunteerism and not just have a partnership for the next African Youth Dialogue, which we are hoping will be hybrid, and some of us will be in her place, like physically, for that. So we will definitely discuss all that. And secondly, food and neglected tropical diseases. We are going to look at decentralized approaches to food hygiene service, especially now that we are talking about informal markets. And food hygiene in informal markets is something that has a lot of question marks. So let's talk about that tomorrow. And then after that, we'll have the presentations from the breakout room. It's just going to be 10, 15 minutes. Each room will have like 5 minutes maximum to present. And lastly, we'll be announcing the winners of the food waste reduction idea thing that we ran recently. And then we'll call it a day for the 2025 African Youth Dialogue on One Health and Sustainable Livelihood. That said, Dr. Lukman, if you're here with us, you can unmute yourself. If you would like to share your screen, you can go ahead to do that. Again, please, if you attend today, try to attend tomorrow. Those that attend both days will have their certificates as soon as we finish the event. If you attend only one, it may take time for us to process certificates. Thank you. I'm checking if Dr. Okay. Well, I'm not seeing him. All right.
Am I authorized to begin?
Yes, please go ahead, sir.
Okay, good evening, everyone.
Good evening, sir.
I'm very sorry for joining behind schedule. I have so many things that crisscross my time this evening, and unfortunately, I couldn't control my time properly. I will be sharing my slide later, so let's just have a talk, and then probably during question and answers, we can expatiate more on so many other issues that are going to be briefly mentioned. The title of my presentation is Rising Cost of Poultry Feed in Nigeria. Am I right, Dr. Dodo?
Yes. Yes, that is it, sir.
So rising cost of poultry feed in Nigeria causes sustainable alternatives and solutions. Well, it is important to start with the fact that if you analyze the cost of investment in poultry farming, you will find out that feed constitutes about 70% of the cost of investment. So if you remove feed from the inputs, what is remaining is not much. I mean, the operational cost when you put away the fixed assets. So this makes feed a very important component of poultry farming. And of course, because of how much it takes in the cost of inputs, every slight adjustment or change in price becomes a significant component of the cost of input and output. Okay, so it's important to begin with this. So let's look at some of the causes of the rise in the cost of poultry feed. Of course, I believe most of you are aware that the cost of egg probably in the last 5 years was around maybe 2,000. And today, the cost is around 5,000. That is like 2.5% increment. I mean, 250% increment in the price of egg. Alternatively, or unfortunately, if you compare this with the price of feed, the price of a bag of layer feed in within or during that same period of 5 years ago was around 3,000. But at the current price is around 14 to 15,000. That is about 5 times the price of, I mean, an increment by about 500% in the price of feed. So the price of output generally is not, the increment is not commensurate with the increment in the price of input. And of course, this narrows the profit margin for the farmer. You will also have realized that a lot of farms are shutting down, and one of the primary reasons is the cost of feed and feed raw materials. So I think this is a very important topic, and so let's just briefly look at some of the causes. Okay, one of the causes of increment in price of poultry feed is the factors associated with macroeconomic drivers, the exchange rate to begin with, and the depreciation in the value of naira. Most of these raw materials, especially the micronutrients, have to be imported. The premix and a few others have to be imported. And because of the depreciation in the value of naira, you bring the price of inputs, jacking up the price of feed. Today, after removal of fuel subsidy in Nigeria, the cost of fuel has increased by about 5 times. So the cost of transporting feed and feed raw materials has also impacted on the overall cost of feed. If we look at the inflation as another factor, of course, you have to increase the salary of your staff, affecting so many other components of livelihood. So this definitely, in one way or the other, will increase the price of feed because the manufacturing process involves so many activities. So inflation affects most of these components, which eventually affects the price of feed. So another factor that we could look at is the agricultural and supply side factors. Okay, if you look at the nature of our agricultural practices, mostly across the country, you will realize that we still operate the, I wouldn't want to say the primitive agricultural practices, but of course, the olden style. So this way, it affects the output. Okay, we have poor output per maybe size or hectare of land. Okay, poor product output. Okay, meaning the yield that is expected from a piece of land is lower compared to international standard. So generally, this affects the supply of this product. We also have other factors like including factors that reduce the quality of our grains, maybe due to poor harvesting practices, poor transportation, and poor storage. And one of the most important factor here is mycotoxins. And that is why our maize is one of the richest in mycotoxins across the world. And of course, this impacts negatively on the health of the birds when consumed. So sometimes farmers, poultry farmers or feed millers have no choice than to, sort maize that will pass for poultry feed products and discard or probably root ones that are aflatoxin loaded for another product rather than poultry feed. So of course, this affects the supply of this raw material. Okay. So many other factors affect this supply, but because of time, I will move on. Maybe during the question and answers, we can expatiate. The industry and market structure. Okay. If you look at the cost of setting up a feed mill, for instance, you look at the cost of the operational cost, including the cost of power, all this will indirectly or directly impact on the price of the final output, which is the compounded feed. So this is an important factor. Unfortunately, farmers cooperative is just an evolving, well, I wouldn't say evolving, but probably re-evolving society. Farmers used to have cooperative in those days, but of course, this is coming back. But because this cooperative is poor, farmers are not able to come together to buy raw materials in large quantity, which will eventually make it cheaper. Of course, that also affects their access to credit facilities. So smallholder farms buy their feed and feed raw materials in small quantities, and this eventually affects the unit cost of this feed in the long run. We mentioned importation of some of these raw materials. So reliance on importation is a very important factor that affects the market structure and eventually the price of the output, which is poultry feed. Now, quickly, let's look at some of the mitigating factors. The immediate mitigating factors. Okay, let's look at some of the operational mitigating factors. One, the farmer must ensure that he optimizes his feed conversion ratio to ensure that every feed that is supplied to the birds are properly utilized by the birds by ensuring that the husbandry practice is top notch, by ensuring that there are, rodents and other intruders don't come in to steal the feed. Okay. Strict feed weighing and all measures that ensure wastage must also be put in place. Okay. Sometimes, of course, you will probably realize that there are certain type of good quality feed that you eat a small quantity and then you feel satisfied. And if you look at some lower or probably cheaper feed, you have to eat like 3 times the volume or quantity of the good quality one before you get filled. The same thing goes for these animals. If you prepare a protein dense or high quality feed, lower quantity of it, get the birds to produce optimally than using a large quantity of low quality feed. So some of these are operational factors that can be adopted to immediately mitigate to mitigate the rising prices of feed cost and to improve the output of what you are using so you can make more profit as a farmer. Okay. Another thing that can be considered is the ingredients. One could look at alternative feed ingredients. Maize is one of the major ingredients in milling poultry feed. You could look at alternative feed ingredients, alternatives to maize. considering particularly most of the sources of energy that are locally available. But one must also be aware of the side effect of some of these alternative raw materials so that the quantities can be utilized can be included in moderate volumes. Broken rice, sorghum, millet, cassava chips, and the likes can serve as good alternative sources of maize when used moderately. Protein alternatives are also available. GNC of good quality, of course, those devoid of mycotoxins, pigeon pea, cowpea. Another good source of protein that is evolving is this soldier fly larva. Okay, so some of these can be harnessed to ensure that the price of input is reduced. The additives, like enzymes, can be added to improve the digestibility and bioavailability of these food ingredients. Okay, so these are some of the alternatives that can be considered to reduce the cost of feed raw material, so eventually reducing the cost of the feed. So don't forget, it is important to adopt some of these alternative sources with good knowledge of the side effects some of them can possess. Okay. One could adopt technology in feed formulation. Okay, and generally this will have an overall effect in reducing the price of feed, pelleting and things like that, which ensure that the bird eats the whole feed rather than being selective. Okay. Another very important factor is strengthening quality control. If you ensure that you buy the good quality feed, that will reduce the overall cost of the output. Okay, because in the long run, you end up with good quality feed that results in good yield. At market level, it is important for farmers to form cooperatives. So with these cooperatives, it will equip them with the capacity to buy in bulk, and that will help them to buy in smaller quantity. I mean, in small at lower price. Okay, I saw someone raising his hand. Is my time over?
Yes, but yeah, you can round off in the next 1 minute. So yeah.
Okay. So now, having said all this, one very important thing that needs to be considered in addition is government policy. In most countries where agriculture is highly successful, government ensure that policies that encourage that improve on profitability of farming are implemented, including mandating financial banks to set aside certain quantity of their profits as loan to farmers with minimal collateral, and providing subsidies and many other policies, including disease prevention and their likes. Okay, so government intervention is very key in ensuring that the prices of feed is controlled and regulated. We don't have much of this in Nigeria, although there are periods when government seems to intervene in providing some quantity of maize to farmers. But if you make critical analysis, you realize that only one feed mill, Olam, for instance, the federal government is producing to poultry farmers, is supplying to poultry farmers in form of subsidy, is not more than what Olam alone will use to mill its feed within 5 days. So it will not go round, and unfortunately, sometimes it even gets to the wrong hands. So these are some of the factors that probably patriotism will address. Thank you very much. I think I will stop here, and then we can discuss some of these things. Thank you.
Thank you very much. That was excellent. I was seeing pictures in my head, even if there was no slides.
So,
Thank you. So,
if
does
there are
anybody have
questions,
any
welcome, so we can discuss
questions?
further.
Yes, so that we can use that as talking point in the next 4 minutes. And then we can owe you 15 minutes because we promised to end by 5, and we are now 12 minutes behind schedule. So please, if you have questions, you put them in the chat box or raise your hand, and we can answer them for questions, or should we ask you questions? Because yeah, this presentation is a case study of Nigeria. So if you also want to maybe highlight what is happening in your country, we have a lot of East African colleagues here. If you want to highlight how it's happening in your country, feel free to also share with us. Okay. Means everything is well taken. Well, maybe there will be questions via email when we share the. All right, David, please go ahead.
Yes, sir. Thank you very much for this opportunity, sir.
Thank you.
Yes, sir. Sir, I have keenly listened to the other speaker, how he enumerated some of the alternative ways in which we'll be able now to make provision for the animals and then be able now to make sure that they are well fed. But another aspect I wanted us to be able now to look into is regarding those very feeds that have been provided to our cattle or our animals. Has there been a research that has gone on or is going on regarding the alternatives, the toxicity level, or what we know as well endocrine disrupting chemicals regarding those very poultry, especially the poultry? Because most of the times, you discover, like myself, I'm a health practitioner. I discovered that the alternative is some of those things constitute a very big challenge to human health in return. So what ways are we trying to be able now to curtail these trends of endocrine disrupting chemical majorly among the poultry? Thank you, sir. I'm done. Thank you, sir.
All right. Yeah. Excellent question. Thank you. Yeah. Doctor, do you want to give a go at this?
Unfortunately, probably my network, I missed part of the.
He's saying sometimes alternatives for livestock feed in general contain like high levels of toxic principles, I would call them. But yeah, you mentioned specifically endocrine disrupting substances. And so he was asking, how could that be curtailed? Like, is there any research going on how to reduce this toxic content of these alternatives to feed for livestock?
Yeah, that's a very important question. And I think it is important for all of us to know that, I don't intend to scare you, but it's important for us to know that even the primary ingredients, the ones commonly in use, not the alternatives, the one commonly in use, investigations have shown that some of them have high level of toxins, could be mycotoxins that heating does not affect. So of course, human consume these toxins eventually. Some of these toxins have the capacity to bioaccumulate in our systems. So as we consume, they remain, and then they keep building up until they get to toxic level. We have these herbicides that are applied on plants in different locations. Some of these chemicals get into the seed, which find its way into the food chain. We have preservatives that people who store feed raw materials use and some of these things get into the food chain. Unfortunately, this is the responsibility of government to ensure that some of this feed and food are wholesome for human and animal consumption. NAFDAC is dedicated to that, but unfortunately, I think they are not doing enough. So the main primary raw materials, the alternative raw materials, no one is checking enough. And a lot is going into our food chain. So only God is protecting us.
Yeah, thank you very much for that apt response. So, well, in my opinion, I think yes, especially for alternatives, we would expect. I mean, if we call them alternatives, it means they're not the primary source. So we would expect that there is a reason why they are alternatives, which is most likely because they have this toxic principles in excessive quantities. But then, like you said, that one is now getting a little bit beyond our own country. If government needs strict measures, and okay, go ahead, Sam.
They are not alternatives because of the toxic composition. They are alternatives because they don't provide the needed micro material that is expected from them. Some of them are poorly digestible. Some of them, are not well utilized. They have the expected micromolecule, but utilization or access to these micromolecules is not efficient. Yeah, a few might be alternative because of their toxic principles like cassava peels, and sorghum. But most of them, it is because of the nutritional value, not the toxic principle, that makes them alternative. Yeah, some of them contain too much fibers that could purge the animal and things like that. So it's the nutritional composition majorly, not the toxic principle.
Wow, excellent. All right, thank you very much. So, well, for solutions, I think yes, again, government has a lot to do, but on our side as well, as we've had the previous presenters, I think we can do as much as we can to educate people about safe handling, safe processing. Because, for example, the mycotoxins, if the maize are properly stored and everything, you wouldn't expect to have high levels of them, in the maize. So there is also that part we can play about building capacities on excellent, best practices for food processing and so on. Abdul Qadir, sorry, I will not be able to take your question, and I'm very sorry about that. We are way behind schedule and would like to call it a day for day one. We're still coming back tomorrow, so if we have time, we can answer the questions tomorrow. So thank you very much, everyone, for your amazing contributions, participation in the breakout room, participation in everything. It was really a great day one for me, and I hope it is for you as well. I'll call on Dr. Sherifat to give a closing 1 minute, like a see you tomorrow talk. And then, we can close the meeting.
Okay, good evening, everyone. This is highly impromptu.
Sorry.
Thank you. Is someone else talking?
No, no. Wait.
Okay. Yes, so 1 minute. Yes. Thank you so much for bringing this and bringing us all together for this amazing session. I particularly had a great time, and I didn't even know I could stay from the beginning to the end. But I learned a lot, and I know that majority of us also learned a lot. One Health and food security should not go in silo. It's holistic and should be addressed as such. We cannot have our food without having animals, humans, and environment interacting. Hence, there's a need to strengthen our policy so that, in particular, youths benefit immensely from what One Health stands for. If you've been able to engage with, for instance, Nigeria's One Health strategic plan, you will see that the priority zoonotic diseases, there are 12 of them as far as Nigeria is concerned. There is only one that has to do with food in particular, and that is the E. coli, organism. So I think that it should be broadened, because without food, we cannot thrive as a community, as a country. We cannot thrive as a people. Diseases and other things set in. So this is a timely and a very important meeting, having us think about food security as far as One Health is concerned, and especially how our youths can benefit. Thank you so much to everyone who came and who stayed from the beginning to the end. We indeed appreciate your commitment and your engagement, especially during the breakout sessions. I look forward to coming over tomorrow, and I hope I would see even more engagement and more participation. Thank you, everyone, and over and out for me.
Thank you very much, Ma. Even though it was impromptu, you killed it as usual. So we will leave since we're out of time, we'll leave the final picture until tomorrow. Where we all turn on our cameras and we take a shot. For now, goodbye from my end, and then see you all tomorrow.